director at Coastal Family Health Center. She provides executive leadership for 25 clinicians and 10 fixed-site clinics, 2 school-based clinics, and 2 mobile van programs. Under Dr. Zigson's leadership, the Coastal Family Health Center strives to promote healthy communities by providing accessible, quality primary health care services to all individuals regardless of economic status. Prior to her current position, she served as the medical director for the Coastal Family Health Center's Mississippi Gulf Coast Children's Health Project, and even volunteered her services as a general pediatrician for Coastal Family Health Center in response to Katrina prior to her official employment at the center. She graduated from Morehouse School of Medicine in Atlanta in 1995, completed her pediatric residency at Emory in Atlanta from 95 to 98. She also holds an MBA from the University of Tennessee, that's impressive, a Knoxville Physician Executive MBA program. She's received many honors. These are very impressive, so I want to name them all. The Lighthouse Women's Business Professionals Woman Achievement Award in Medicine in 2011, Coastal Women for Change's Collaborator of the Year Award in 2011, Delta Sigma Theta Sorority's Physical and Mental Health Excellence Award in 2010. She was chosen as one of 50 physicians for the Rose Garden event at the White House, a VIP health reform event with President Obama in 2009. She currently serves on several boards and maintains many outreach communities and advocacy positions. So I don't take up any more of her time. Here is Dr. Wilson.
My watch here, I think we're supposed to stop at 7:30, 7:32, so I'll be here for 2 minutes.
7:45.
7:45, okay. Little time together. Okay, so a little bit of what I've been hearing from you guys is talking about where we are with poverty, of course. How many of you are from the coast? Everybody in the room from the coast? Some of you are not. Where are you from? Did not raise your hands.
Jackson.
Jackson?
Tennessee.
Tennessee?
South Alabama.
South Alabama. Okay, so along the coast, those of you from the coast, where do you live? How many of you live in Waveland? How many of you live in Hancock County, somewhere in Hancock County? Harrison County. Okay, Biloxi? How about over in Jackson County? Okay. How many of you live somewhere near the water, had some damage to your home during Hurricane Katrina? How many of you know somebody who had damage to their home? Okay, so let's all close our eyes for a moment and think back to Hurricane Katrina. And you woke up and things weren't the same, right? There was devastation everywhere. The places you knew were not there anymore. You were maybe trying to find your things, didn't know where your people were. That store that used to be on the corner is no longer there. So weeks later, you've got to find some place to live, right? How many of you lived in a trailer for a while? How many of you had to go live with relatives? How many of you live with relatives that you really wish you hadn't? So relatives were trying to be nice and have you come live with them, but that's a change in their home, right? Okay. So now you're living in a trailer. How many of you had to move from that trailer to another trailer? How many of you moved from the trailer you were in to someone else's home or to a hotel? How many of you had more than one move during that time? Okay. All right. How many of you didn't have a job or your parents didn't have a job during that time? All right. So ladies and gentlemen, you've just felt what it's like to be in poverty. That's what our people are feeling every day. Some of them don't have constant homes, as we've talked about. They have to live with a relative from time to time. Sometimes they have to move from one place to the next, so the kids have to leave the school that they were in to go to a new school where they don't know anybody. That grocery store that used to be there on the corner is no longer there. And you're trying to scrounge around and get your life together, right? So you're looking for a safe place to live, food for your family, trying to find employment. Guess what's the last thing you're thinking about? Health care. Health care comes because you just have to go, right? So if you had a cut or if you had something going on, you've tried to find a place to go for that. But were you going for preventative care that day? Oh, it's time for my pap smear. Think I'm going. No, weren't doing that. You're only going for things that were of an emergent nature, right? So that's what I see every day when I have people come to our clinics. Folks wait to the very last minute because that's not the most important thing on their list of things to do. And it's when it becomes an emergency that we end up seeing those folks. So how many of you are familiar with the federally qualified health centers, community health centers? Anyone familiar with Coastal Family Health Center? Okay, so you've heard of Coastal? How many sites do we have? Do you guys know where we are?
I know you have one in Folker and
Gulfport,
Gulfport.
Okay. Okay, so pretty much we're along the entire coast. We have about 10 sites now. We had 5 before Hurricane Katrina, and then we've expanded to 9 sites, to 10 sites. And then we have these mobile van programs, one for pregnant moms and one for pediatrics. The 2 mobile van programs came after Hurricane Katrina, and actually were loaned to us initially for us to help get access to care to folks who couldn't get it. So you couldn't cross over different roads, right? You didn't know where to go for the help. So the mobile vans came out to try to help. And then we kept those mobile vans because we knew that access was still a problem for a lot of folks. Well, the thing we found out here in Mississippi, especially along the coast, is that we already had a problem. It's just that Hurricane Katrina made it where everybody could see what the problem was. And so this wasn't new, it just was covered up. We kept putting Band-Aids on things. And so now here we are trying to fix those things. And so what you're doing in your work here is so very important to what my providers are trying to do at Coastal Family Health Center. We talk every day about how much more difficult it is to take care of patients. It's more difficult because we're not just putting our hands on them, listening to their heart and lungs and saying, okay, go home and take this medication. That's what we like to do. But then the patient comes back. Did you take your medication? No. Blood pressure's still 160 over whatever. Did we lose any weight? Nope, we didn't lose any weight. In fact, our weight went up. Wow, did you start the exercise program? Nope, didn't do that. But I want you to go ahead and write that prescription again and give me that medication. So what's wrong with that picture? We kind of miss everything else that doesn't allow that patient to do what we need them to do. We're always talking about compliance of our patients. They just won't do what we tell them to do. They just won't do what we tell them to do. But then we find out, well, couldn't do what we tell them to do because they live in a neighborhood where they can't walk. Couldn't do what we told them to do because the medication, they had to forego that this week because we had to pay the rent. Couldn't come and get the medication because the one car that we have broke down and the neighbor's car broke down and the other neighbor who would let us use their car wants $20 for me to get there. And so there are all these other things that factor into why people in poverty may have more problems with their health care. In fact, they factor into why you and I may have it and why anyone else would have problems. We're not always thinking about the environmental impact on our health. And so the fact that we have nutritionists coming out of here, that we have social workers coming from here, that we have those of you who are interested in, what was that, the exercise, all of that are very important to our ability to take care of patients in totality. And especially if you're thinking about people who are in poverty. So low-income families tend to have more of those outside factors that impinge on their health care. So take for instance the kids that I take care of. I'm a pediatrician by training, and so that's who I see. So I have this one kid who comes on our mobile unit, and our mobile units are linked to schools mostly. And so when we're on a school property, we'll get these kids come in, and we were getting a ton of kids that are coming on for behavior. It's always their behavior. Can you do something about their behavior? They're just out of control in my classroom. Now, I don't know if it was the teacher, who just couldn't take anymore, or is it a kid, or what? So I have this one kid come in, and the way our mobile van works, we have a driver who also serves as our registrar. So he drives the van, and then he turns around and he's the registration guy. And folks sit on the little van and they talk to the registration guy, and then they come walking down our little mobile van to my nurse who takes their vital signs, and then they go back to the back of the room there where I can see them for their care. Well, usually while I'm back there, if the parent doesn't come up, they're sitting there talking to Mr. Anthony, who is our driver. Mr. Anthony is local. He's from Biloxi. He knows everybody. And if he doesn't know everybody, he'll know you before he's done with this visit. That's important to have someone who knows the people when you're working poverty-stricken families, or when you're working in local areas where folks don't always have access. When they see me, Dr. Dixon, Dr. Dixon? Well, she's Dr. Dixon. But then Anthony talks to them and says, so what's going on? You know, why is he acting a fool in the classroom? So talking in a different way than well, maybe we should be talking about ADHD, and maybe they have this. Anthony was like, what's going on? Why do you think he's acting a fool like that? And so after I see this one child who's just acting out in class, and I decided, well, we're going to do all these screenings so we can see whether it's ADHD or hyperactivity versus this, or maybe there's a problem with depression or all these other things. You come out and Anthony says, Dr. D, let me talk to you for a minute. So we talk. They don't have food in the house. He hasn't eaten in a while. He's had a toothache, according to his mama, for like a month. They haven't been able to get anywhere to get that tooth fixed. So yeah, he's cutting up in class because he can't think. He can't think. His tooth is hurting. He hasn't eaten. So why did the mom tell me that? Why do you think the mom didn't tell me that? She's embarrassed. She's concerned that somebody's going to call DHS on her. She's concerned that she's not going to be able to do anything. There's nothing we're going to do for her because we are the doctor's office. What are we going to do about her food situation and the fact that her baby's tooth is hurting? So that's why all of those factors are important, because there's always more to the story when you're dealing with families in poverty. And you got to get to those stories to be able to help these families do well. That means you've got to have all of that information. You've got to be able to find out who's in the home, what's happening in the house, what are the other factors that are bothering them. And then not only that, you got to figure out how to get them the services that they need. So you guys are going to hear a lot in the coming years, and it already started when healthcare reform first was out there, that we are looking to have this patient-centered care. And it's a buzzword, patient-centered care. It's got to be about what that patient needs right now to help them to be their best and healthier selves. Because we know if they're healthy, then we have someone who's going to be productive in our community and able to go to work, right? And be able to help us. So that's what we're trying to get to, is people being able to be productive in their lives and do well. And we do that by knowing all those other things that are associated with their health. And you help us to do that. So a lot of times you're not thinking about, well, what will I do? Well, health educators, man, we need you. We need health educators so bad it's not even funny. But we need health educators who are not afraid to go out into the hood or go out into to the side corner there and talk to so-and-so. So a lot of programs are moving toward that. In fact, one of our insurance companies, both of them, United Healthcare and Magnolia, they have these new plans for kids on disability and for seniors, right? So these are our most chronically ill patients who are now on these managed care programs. Well, they have community workers who go and look for the patient for you when you can't find them, when they haven't done what they're supposed to do. Now, why do we have to do so much? I mean, we have to do so much to make people take care of themselves and be healthy. It's because of those things that we talked about. Getting back to Hurricane Katrina. What was your mind on? It wasn't on your health. It was on just trying to survive day to day and trying to make sure that whatever you could do for your family, you could do. Okay, then add on top of that the stress. So we're seeing tons and tons of kids and families coming in who are impacted by mental health concerns. We don't have enough adolescent and child psychiatrists to help us take care of these families. In fact, we don't have enough adult psychiatrists to help us. So where are folks coming? They're coming to the community health center. And my docs and I are going crazy because we're like, Lord, we don't know how to take care. Nobody told us how to take care of depression and schizophrenia and bipolar disorder. Nobody told us how to do that. It wasn't a part of the training for a primary care provider. So we're even having to change the way we train physicians and nurse practitioners and physician assistants on how to take care of a patient. Because we learn from here down. All this up here, it goes over. And so here down, but here, not my area. Not my area. But definitely is our area because it it impacts how these kids do, whether they will be able to get educated, whether they will be able to get a good job, whether they understand that a mental illness is no different than their asthma, than diabetes, than hypertension. And that's why I try to tell our families, don't think of that as something totally different. It's just that the problem is here, instead of here, or here, or here. And so we have to deal with that as a family, together, meaning me and you and everyone who supports you. That includes my support team of folks that I can reach out to in the communities to help us with our patients. So it's kind of a different time that we're in, and how we're going to make our communities healthy and whole. And all of that involves all of us. We really have discovered that healthcare is not a separate issue from housing or education. It's all a part of the same spectrum of problems that we have to deal with families. So I heard a couple of things, and I wrote those down. I wanted to just mention something I heard earlier. We talked about the pendulum swinging. Talked about which way are things swinging. Well, the pendulum swings depending on how you help us. It is our duty to make sure that we are looking at what the country is doing to help us with our families or with the healthcare folks, right? So it's important that you know what's out there in terms of the bills that are pending. How does that affect the families that you serve? The Affordable Care Act is an important bill that we have to look at. We may not like all the parts, but I sure as heck like some of them. So take for instance, we'll call him John. I started seeing John about 5 years ago. He is now 21 years old. And when I first saw John, he was missing anywhere from 3 to 4 days out of school because of his asthma each week. He was going to the ER as a revolving door. And if mom didn't like what they said at Singing River, then she took him to Ocean Springs. She didn't like what they said at Ocean Springs, then she took him to Gulfport. She didn't like that, she went to Biloxi Region. So they were just going through the ER systems. Well, they ended up on our mobile van, and we established a primary care health home for him. We discovered that he was allergic to everything, so we finally got him with the pulmonologist. First of all, we had to get him on Medicaid. He wasn't even on insurance. Mom hadn't done that part yet, but you're getting these bills at the ER. Well, we didn't care about those bills because we weren't going to pay them anyway. So the emergency room is having to pile up all these bills to take care of this kid. It's a different doctor who's taking care of the kid with different ideas about how to manage them, right? So we finally get this kid stabilized. The other thing about John was not going to finish high school because he was missing too much school, so now he had been put into a special class, not because he wasn't bright enough, but because he just wasn't there. So we got him stabilized, then we helped to get him a tutor so that he could hopefully graduate with his class and be able to get an actual degree, not just be put out to get a GED if that's not what he wanted to do. So by the time he was a senior, he did graduate. He graduated, and we were really excited for him. That was really good that we had gotten this kid where he was steady in school, his asthma was managed, and then he became an adult. He at 19 lost his Medicaid, of course. He went to work at a local Waffle House, and they bring him in when they can, so it's not a steady job. So I get a call from his mom just about 3 days ago. He's been in the ER again. He was in the ER for a number of things. I don't know, they did a CT scan, and they did that. So, huge bill. And they tell me he needs to go to a neurologist. Dr. Dixon, what are we going to do? I don't know. You have no insurance, no way to get him there. He has no access to health care now. So, is he taking his medicine? No, doesn't have that anymore. Well, we can't get him in so he can at least get his medicine. Well, now he's smoking. And now he's, all these other factors, these things that he's doing now to, relieve stress that are impacting his health. And so I like that the Affordable Care Act allows kids to stay on their parents' insurance until they're 26. So some of my college kids or some of my other kids whose parents actually have insurance at least have that for their children. That helps one of my grannies who was taking her own medicine money, her money for her medicine, who was now buying medicine for her college-aged grandson. He had ADHD, couldn't afford his medicine anymore. She was taking her money for her medicines and buying his, because she's like, he's gonna get through college. And he can't do it without this medicine, so I'll do without mine. Well, fortunately, when the Affordable Care Act, that part of it came into play, she was able to put him back on her insurance. So we have to look at what's good about some of this. Everything is not gonna be good about any law. But we've got to look at how does it impact the people we're trying to help and what we can do to make that a reality. That means we have to get involved. That means you have to call. That means you have to know who your senator is, who your representative is, and you have to make a call and help the people that you serve. So that's one of the ways that we do that. And it really is you, on the ground folks who are seeing it every day, that make a difference. It's the stories that you tell, the people that you see, the differences that you make that are going to be most impactful to how we move forward in this country around healthcare and folks who have the least access. So back to Hurricane Katrina. When I came, guess who was having the most difficulties with accessing care?
Elderly.
The elderly, children, and folks with disabilities. Those are always going to be the folks who will have the least access to care. And those are the folks who maybe use up the majority of our health care. It's like 20% of people use up 80% of health care. So if we can do some things to impact those groups of people and how they are able to get care, then we'll find ourselves in a whole different realm of how we do things. We really do have to pay attention to why is it Mississippi is number one and everything is bad. But we've got farms, we've got some access, pretty much community health centers in every community. So what are the things that stop us from breaking through those numbers that we see? Why is our teen pregnancy rate number one? Not getting any better. You know, why do we see that? Well, you know, we've got to figure out what things work. And it doesn't work just to say no, apparently. Just say no, doesn't work. Doesn't work to say just go eat some good food. You know, why don't they just cook food? Doesn't work. So what is it that we can do that's different than what we've been doing? And that's where the innovation comes in. That's where the things that you were learning help us to make a difference. That's where different things like a mobile van that takes the care to the people makes a difference. That's where a full team that consists of not only a physician, but the pastor, the mental health worker, the nutritionist, the exercise physiologist, that's where all those kind of things make a difference in communities that have been doing the same thing over and over again and getting nowhere. So if I can encourage you to do anything at all, is learn what you're learning well, and then figure out how you fit into making a difference for the communities that you have here on the coast and everywhere else along Mississippi. We have a lot of work to do in Mississippi, and we need each of you. If I can encourage any of you to, you know, once you finish what you're doing, please, some of you go to medical school. We really do need some primary care providers here. I have a tough time getting physicians to come to Mississippi. And I think it's a shame too, because it's a great place to live. I found it to be, you know, a wonderful place. So, I think I kind of covered everything. I'm going to make sure I'm not going over your time too much. But I did want to say that, you know, that when we talk about why people don't think about health, you know, we see everybody in our clinic. And I will see, you know, a poor person come in with their nails done who won't get that medication. I'll see a middle-class person come in, they're nice farm, who doesn't want to pay their copay again. I got to pay again. And you will see a person who you may see in another setting who can't afford everything, still don't want to pay that copay. Golly, $20, $30 to see the specialist? Are you kidding me? But we'll go to an NBA ball game that costs me $200, or go to every Saints game. Those are people I work with. You know, we're gonna forego that, I'll get to them later, but I gotta, so it's about priority. Healthcare is not a priority for folks. And so when we're thinking about, why people don't take their health care seriously, why poor people do what they do, think about where you were when Hurricane Katrina, when you were kind of in that setting. Think about where you are today and where healthcare fits in that, and what you're trying to do for yourself. And it's going to take a lot for us to change that mindset that healthcare is just as important as all the other things that you're trying to do. And all of you can help us get there. Thank you.
Y'all did a fantastic job. 3 great speakers. That was a great event. Y'all ready to get out of here?